Welcome. I'm John Collins and I'm with the Parkinson Society. Parkinson Society Canada is launching the Get It On Time campaign to make sure that people with Parkinson's in hospitals and care facilities get their medication on time, every time. When people with Parkinson's don't receive their meds on time, their symptoms can get out of control and they can become very ill. The Central and Northern Ontario region is the first region in Canada able to provide these Get It On Time in-services and this video, and we're very excited to be able to do so. I'm here today to give some general Parkinson's information, to talk about the symptoms and their management, and we'll talk about Parkinson medication and how it relates to this new campaign. More than that, I think this video is here to help make your job easier. We understand and respect the significant challenges in providing care to an overwhelming number of patients, and I think that we have some tips in this video that can help make your care of Parkinson's patients that much easier for you. Parkinson's occurs when dopamine, which is a naturally occurring chemical in the brain that helps regulate movement, cells die or become impaired as part of a change in the chemical makeup of the brain. With insufficient dopamine in the brain, the symptoms of Parkinson's appear and activities of daily living become a little more difficult. Parkinson's is an individual condition and no two people will experience it in quite the same way. In particular, a person's response to medication often differs, so try not to compare or anticipate a person's response based on what you've seen in another. Treatment is individual and medication has to be prescribed to suit the particular needs of each person. People will have different times of day, frequency, and forms of medication, even if they're trying to control the exact same symptoms. Parkinson's is a progressive condition, and as it advances, which is typically when people will be arriving in a care setting, new and more symptoms appear, and the existing symptoms may be less responsive to treatment. The four main motor symptoms of Parkinson's are recognized by the acronym TRAP, T-R-A-P, which is sometimes how people with Parkinson's will describe the way that they feel within their own body. The T stands for tremor. This is a rhythmic back and forth movement of a body part. It tends to be more pronounced at rest and should dissipate with voluntary movement and with focused action. Even though this is the symptom that people most often first associate with Parkinson's, it's worth mentioning that not all tremors are Parkinson's related. Not everyone with Parkinson's will show a tremor, and for those that do, it's unlikely to be their most disabling or disruptive symptom. In fact, Parkinson's is fundamentally about a lack of movement. In its natural state, we're talking about a condition that affects people's ability to move, and to do so safely, rather than causing them to move too much. And that brings me to some of the other symptoms. The R stands for rigidity. This is a muscular stiffness or weakness, and it's caused by a constant stiffness or contraction of the muscles. Along with this symptom comes a resistance to passive movement, which is movement that's applied from the outside or by another person. The A stands for akinesia bradykinesia. Akinesia is an absence of spontaneous movement like a reduced facial expression or a slowed reaction. Bradykinesia is just slowness of movement. The P stands for postural instability, and as Parkinson's progresses, people may lose their natural postural reflexes, may lose an arm swing while walking, and develop a stooped posture, and all of this leads to greater risk of falls. I have a little example that I'd like to try with you that helps illustrate what it's like for someone with Parkinson's. Please place your feet firmly on the ground, bend your knees, place your hands somewhere comfortable, and sit with your spine really stiff and straight and rigid. Now, without being able to bend, I'd like to ask you to stand up. Right, and you can't, can you? It's not that you don't want to stand, it's that your body's presenting some difficulty, and that's just something to keep in mind for people with Parkinson's. It's important to acknowledge that not all the symptoms are visible, and it isn't just things that you can see. It's also important to remember that, like the motor symptoms, not everyone will experience all of these symptoms, and people are going to experience them differently. There's a long list of non-motor symptoms that can affect people with Parkinson's, and I'm going to take the time now just to highlight a few of them. There are a number of common emotional changes that can come along with Parkinson's, and anxiety is a big one. This is problematic because it can aggravate some of the existing symptoms of Parkinson's. The slowness of the gastrointestinal tract can lead to bowel obstruction, which becomes life-threatening for people with Parkinson's, particularly in long-term care. Constipation is very common, and it's important to treat this right away. Dizziness and hypotension are also issues. People with Parkinson's may need increased time, particularly when rising from a seated position or getting out of bed. Try to stay in place for a moment after helping with one of these tasks, and remember to complete all tasks slowly. At this point when speaking, I typically ask a question, and it's what percentage of patients at your facility do you think have some degree of dementia? I typically get a high response, and that's fair because you know the clients that you're working with, but it's important to know that this occurs in a relatively small number of people with Parkinson's. They do deal with some other cognitive issues, like bradyphrenia. Like bradykinesia, this has to do with slowness, but of thinking. Just because people with Parkinson's have trouble communicating or they're a little slow when responding, don't necessarily assume that they don't understand you. Much like when moving, if we give extra time to respond or complete an action, most people with Parkinson's can achieve their desired results. Try to remember to make one ask at a time. If you come into the room and said, okay, we're going to get out of bed, go to the washroom, go get dressed, and go have breakfast, well, that's really 4 asks very quickly. And if someone's lost their ability to properly prioritize or sequence events, they may be stuck on task number 1 while you're hoping to be achieving task number 4. It is important to note that, as we said, not everyone who has Parkinson's will exhibit all of the symptoms that we've discussed, and not everything that looks like Parkinson's necessarily is. There are several other diseases worth noting as forms of Parkinsonism. We refer to these as Parkinson's plus diseases. Within 3 to 5 years of the initial diagnosis, they progress quite differently, and they don't respond to the same Parkinson medications. The 4 Parkinson plus conditions are Lewy body dementia, corticobasal degeneration, progressive supranuclear palsy, and multiple system atrophy. If someone has one of the conditions listed here, they are likely to require more complex care. Please be sure to check their care plan before proceeding.